To start, if you don't know what the pelvic floor is, it's basically a group of muscles that supports your bladder, your uterus, and your rectum. So these muscles are really important in bladder, bowel, and sexual function, and they're also part of your core muscles, which means they play a role in stability of your spine and pelvis. So basically, these muscles make up a sling. So they start at your pubic bone, they come around to your tailbone. So here's a diagram of your pelvis to help give you a visual of where the pelvic floor is, because it's important to know where these muscles are. So let's make sure it's clear. Just to help orient you, here's one of your hips. So this is a hip joint right here. And this bone here is called the pelvis. More specifically, let's look at the points where the pelvic floor muscles attach. So here is what is called the pubic bone. To find your pubic bone, you can start at your navel or your belly button and go straight down toward your pelvic region until you feel a bony area. That's your pubic bone, and that's one of the attachment points of the pelvic floor. Now, if you remember what I said before, the pelvic floor is like a sling of muscles. So where does this sling go? Well, it goes to what's called the coccyx, or more commonly known as your tailbone. And that's right here. Your tailbone is the lowest point of your spine. So this is the other attachment point of the pelvic floor. So the pelvic floor starts at the pubic bone in the front part of your body, and it makes a sling to attach to the tailbone or the back part of your body. These are important muscles, and they can go through some changes during menopause, so let's talk about it. During menopause, the pelvic floor muscles can go through what's called atrophy. So atrophy is basically when the muscles will have less muscle tone and the muscles can become weaker. This might lead you to believe that the pelvic floor muscles will definitely become weak with menopause, but this isn't always the case. The pelvic floor muscles can also become less elastic with menopause, which means that they don't stretch as much anymore. This loss of elasticity can actually cause the pelvic floor muscles to become tight. This distinction is important because if the muscles are tight, it's important to work on relaxation of the muscles before working on strengthening. This is why Kegels aren't always the answer. A pelvic floor physical therapist or physiotherapist will be able to examine your muscles and determine if you have tightness or weakness, or you could even have both or neither, okay? If you are experiencing pelvic health issues like urinary incontinence, pain with sex, pelvic pain, fecal incontinence, I would definitely suggest seeing a pelvic floor physical therapist for an evaluation to make sure you're taking the best course of action.